what's interesting about cancer is I really see it as the next frontier. I mean, there are, if you look at the recent numbers, I mean, cancer already ranks with HIV, tuberculosis, and malaria as one of the leading killers in sub-Saharan Africa. And if you project trends over the last few years forward, it will eclipse all of those diseases, within the next couple of decades. So I really see this as the next frontier in global health, and I think UNC has a tremendous opportunity to be an international leader. I really have gone into oncology primarily out of an interest in how best to diagnose and treat cancer in resource-limited settings, particularly in sub-Saharan Africa. And, obviously I'm very interested in the substantial overlap with HIV and other infectious diseases in that part of the world. I think it was largely my experience in Tanzania that really motivated me to pursue this as a career. While I was living in Tanzania, I was primarily providing care to HIV-infected families, and as well as providing inpatient care at one of the large national teaching hospitals in Tanzania, in a setting where there's dramatically less infrastructure. I mean, exponentially less infrastructure, not just a few less mammography machines, but no mammography machines, no pathologists, no chemotherapy, no facilities to administer chemotherapy. So again, having that experience and kind of projecting forward a little bit, I thought, to me, it seemed like a very important area. I guess the two things that made it all quite tolerable were just how embraced I felt within both divisions as really a part of the infectious disease division and a part of the cancer hospital and the hematology oncology division. And then also this sense that it was all building towards something that I think has real importance and value. My understanding is that I'll be the only oncologist in a country of 15 million people. So initially we're trying to develop projects related to very common cancers in that part of the world, particularly ones for which we think we can have a real impact in terms of providing effective treatment to patients, potentially curing patients if we're able to diagnose them at early stages of disease. One of the really kind of hallmark successes of the UNC program has been its ability to really engage the community and develop a clinical research agenda that also kind of really delivers a major impact, not only kind of on the global policy level, but also to individual patients in terms of their health. In 2006, it was estimated that cancer registries covered about 11% of Africa. It's really hard to get a sense of how much cancer there is, what types of cancer we're seeing, and so Carol has established a cancer registry, which is still in its infancy, and I think we'll get the quality of the data will get a lot better. But it's been a real eye-opener just to get a sense of how much of various types of cancer there are, again, in framing, what are sort of the key areas that we need to be focused on, sort of in terms of, frequency, impact, etc. My hope is that we can really define sort of a clinical research niche and a clinical service niche that has real impact, together with, Malawian providers who we've have a long history of working collaboratively with at UNC and who are actually UNC faculty. If we approach this with kind of seriousness, with sort of a range of expertise, ranging from real kind of clinical, how do we treat and diagnose these patients, to basic science questions, and involve really a range of expertise, which I'm proud to say we have at UNC really across the spectrum. I think we may well gain biological insights that have relevance not only for sub-Saharan Africa, but for patients around the world.